Nic, welcome to the Truth Contract.
Thanks for having me.
Well, I know you are a very busy man. I have been following you on X for probably about 6 or 7 months, and I don't know when you find time to sleep.
I'll tell you, I don't get much sleep. I will finally get rest once these dangerous medical interventions are off the market.
Right. Well, anyway, thank you first of all for all the work you do. And today I'm going to break our conversation into two parts. You may or may not be aware, but we, the Truth Contract, have had a sort of special project called Sperm Egg Geddon, which has been looking into the accelerating decline in sperm quality and quantity and in egg viability and quantity. And I'm going to share just a few little slides with you from that presentation so you've got some context. So can you see my screen?
Yes.
This all started about 2 or 3 months ago when on X I found this slide. And I had a number of questions. The first question was, who published this? Is it a real scientific study? And of course it was a very famous doctor in New York with the world's biggest ever study. The second question was, what happened after 2011? The next question was, what's caused this? And can you see my next slide?
Yes.
So we basically investigated 12 different areas where there was peer-reviewed scientific evidence that these 12 different factors had specific scientific research to show the decline in sperm quality and sperm quantity and egg quantity and viability. And so we've looked at all of these. And the one we're going to focus on today is number 6, pharmaceutical and medical interventions. And so the highlights that we came across were prescribed and OTC medications, mandated medical interventions, COVID-19 mRNA, which is what we're going to ask you to focus on today, radiation, chemotherapy, radioactive contrast dyes, long-term use of pharmaceutical contraception, elective terminations, repeated failed attempts at IVF. So there were lots and lots of things that in the 6th point of pharmaceutical and medical interventions, we found direct evidence, and I'll just show you a couple of slides, all of the peer-reviewed science that we looked at, that caused specifically an accelerating decline in the sperm and egg issue. And so I'd like to start off today's conversation if you would share some of your research and some of your thoughts specifically about reproductive challenges, and in particular the mRNA point that we found. Is that all right?
Yes, that sounds good. And so looking at your slides here, you have identified, I think, very solid points that are contributing for sure, right? Because we do know that, we are bombarded on the daily basis with new and ever increasing numbers of toxins. And as each year has passed, like in your first graph there, since the 70s, we are introducing new exposures in the environment. And that is obviously a major contributor to the declining birth rates and declining fertility for a while. But this has sadly been accelerated by the mass uptake of mRNA gene transfer platforms into basically all of the Western world. So we know that about 70% of the global population did receive at least one dose of a COVID-19 vaccine, right? And so some of these doses, like in China and in some places in South America, they did receive non-mRNA COVID shots, which were still actually proven to be bad for fertility anyways. But 70% was exposed to fertility reducing injections. And so obviously this needs to be looked at intensively, and it has been now, at least recently. So we can start with men. There have been a lot of studies that have looked at the effects of mRNA shots on sperm. But there's one in particular out of Israel. They looked at about 36 sperm donors before the vaccine, 3 months after the vaccine, and then up to 15 months after the vaccine. Right. Before, they had healthy sperm concentration, motility, everything was good. They get the shot, and then on average, out of these 36 donors, 6 months or 3 months after the injection, they found 15% reduction in sperm concentration from these mRNA shots, and I believe a 20% reduction in total motile count of sperm. And so basically,
Motile count is the swimmability.
yes. So basically, you have sperm that's not going to be able to successfully, reach the egg and conceive because they're quite deformed now. Something has gone wrong, and that's probably because the mRNA does reach the testicles and causes all sorts of cellular damage. And so that's with males. Other studies have looked. Some claim that it increases sperm count, but that's obviously with confounding variables. There's no mechanism that these shots can increase sperm count, right? It's just ridiculous. Actually, any medical intervention that induces immune response, induces fever, is going to decrease sperm count, at least temporarily, right? There's no mechanism these can increase it. So those are bunk, right? That's just not the case. So we have that with men. More investigation there is needed. But what's very concerning is with women, right? With their eggs, with their egg supply. There was a recent study by Karaman and colleagues that injected rats with mRNA shots. They injected them with non-mRNA COVID shots, and all of them destroyed the primordial follicles of women. So that's the non-renewable form of egg that women are born with, and they don't regenerate, right? So what the mRNA shots did was they caused the most damage, wiped out 60% of those primordial eggs, right? So that is catastrophic, right? That's going to significantly reduce fertility outcomes. And so not only did it destroy those, but it destroyed the primary, secondary, tertiary eggs, right? So it just wiped out the ovarian system in these rats. So we know it destroys it in animals. And then we also now have human data by Manichi and colleagues. She found, she looked at over 1.3 million Czech Republic women, and the vaccinated women had 33% lower successful conception rates compared to the unvaccinated women. So we see it now in large human data sets as well. So, and obviously we now have birth rates collapsing all across the world, reaching all-time lows now. So, yeah, we are in a very difficult situation, and it definitely appears that these mRNA shots drastically accelerated the fertility decline.
There are a number of studies. The one I put on the slideshow just now from Shana Swan, which is I think the biggest study out there. It finished in 2011, was updated in 2017 and 2020, which has been reported on, and various other studies we found around the world finished in 2017, 18, 19, one finished in 2020. And from the big report, which ended in 2011, the rate of decline was accelerating all around the world. But of course, in 2020, 21, we introduced the mRNA component, and which is why, and it's been very difficult to find studies other than the ones you've mentioned and a few others that we've found, which show essentially that rate of decline, which was accelerating all the way through to 2020, has accelerated even further since 2020. And so one of the things that I don't know if you have a comment on, but this is really an existential threat to humanity, which humans have caused.
Yes.
This isn't climate change or some other thing. This is a man-made existential crisis. And without exaggerating it, if this trend continues, within 25 years, the demographics of the world will look very, very different. And we're going to have a significantly reduced population, a significantly older population, and we're not bringing young people into the world or the workforce that are going to be able to cater and look after people who are dying or disabled or injured or infertile as a direct result of this mRNA technology.
Yes. So you laid out the disastrous future now that we're facing, unfortunately, because you're right. You're gonna have an old population, growing population. Our generation now, all these kids, all these young women that were injected will now, unfortunately, most likely face drastically reduced chances of successful pregnancies. There's going to be far less kids being born, and that's compounded with the serious adverse events and delayed adverse events that vaccinated adults will be facing as well. So the entire population was poisoned at a mass scale, with long-lasting genetic material. So this is obviously a disaster, but what appears to be planned anyways is most of the workforce is planned to be replaced by robots, right? And so that's where we're headed. They claim, we have people like Elon Musk claiming there's going to be robots everywhere in 2030. And we have Bill Gates saying there's going to be no teachers anymore. There's going to be none of this. Basically no doctors even. They said there's going to be robot doctors. So it appears to be some sort of phase transition into a artificial intelligence world.
Nick, is there any way that the harm that's been caused either to men or women from a fertility point of view, are there protocols that can reverse or halt or slow down? I know that the McCullough Foundation have come up with a number of protocols and suggestions that people can follow with a view to stopping the decline, reversing the decline. Can you comment on possible happier solutions than robots?
Yeah, I want to say I don't support the robot replacement, right?
No, I don't either.
Yeah, I don't support the robot. I think it's terrible, but I'm just saying that's why they don't care that everybody's getting decimated, right? Because they plan to replace the workforce with robots. That's why the elites don't care. That's why our public health agencies aren't finding solutions for this. We don't want to be replaced by robots, but so that's why we do need to save ourselves. We need to save, humanity from this decimation. And so what we've identified is there's a few key things. First is so first I want to explain, no government has researched vaccine harms, how to heal them. None. I mean, I have not identified one study, not one well-funded study. So at the McCullough Foundation here, we are searching intensively. A few other nonprofits are searching, but that's all we've got. So right now,
one thing we could do before a solution is hopefully found is we can just stop taking these things.
Right, exactly. So that's the first step, right? Get them off the market, stop the population uptake of mRNA. You're right. That's step one. And then we can start to assess the full spectrum of damage and introduce healing interventions. The first interventions that will be required are obvious things like lifestyle. So one thing, diet, right? You can't be eating super hyper processed garbage. Since that already decreases fertility, increases, cardiovascular disease risk, cancer risk. You got to start eating a whole clean diet if you've been injected.
I'm going to put this slide back up again, I think, very quickly, because there was something I specifically wanted to mention. When we looked, sorry, can you see my screen now? This one?
Yes.
So when we were researching all of this, we found, past, present, and chronic medical conditions, psychological stressors, toxins in the home, personal care. And we had a golden rule, which was that any research that we found in any of those 12 sectors had to specifically have scientific peer-reviewed research which pointed to the male and female fertility issue. However, 8 out of these 12 also led to myocarditis. 7 of them led to cancer. Toxic chemicals in personal care products and toxins in the home, 7 of them said, oh yes, and there's also, cancer risks as well. So we're living in a toxic soup.
Yes.
And whether it's what you eat, the personal care products that you put on your body, the household cleaning products that you're surrounded by, 5G, geoengineering, spraying stuff from the sky, fluoride in the water, not taking the pill and lead and stuff out of the water, toxic chemicals in agriculture, the glyphosate problem, the bovaire problem in cattle, food processing. It's like we are literally living in a toxic soup. Now, what we're going to do with this Spermageddon project is work on as many of these domains as possible, is what people can do now immediately to clean their act up and remove as much of this toxic soup as possible. And the two that I'm the most worried about is the pharmaceutical and medical interventions, which we've been talking about, and 5G and EMF. And I'm worried about those because the resistance to from the machine, if you like, to stopping those two things is going to be very hard to overcome.
Yeah, I agree. EMFs play a major role in many diseases. And what's most concerning is they really do like to roll out novel non-ionizing radiation technologies, every decade or so, right? So they got 4G out without really any human safety testing. Then they roll out 5G, don't know what it's going to do to humans. And so they kind of just roll out this globally without knowing really any risks. But we do actually know the risks, right? Because there are so many studies, preclinical studies that have looked at these technologies, and they find harm to all types of organ systems. We have neurological disruptions, immunological disruptions, even direct cellular toxicity, cancer risks. Yeah, it's absolutely disastrous what's happening with this. And now, people don't care about it because they don't see it, right? You don't see these 5G waves with your eyes. If you could put glasses on to see the full spectrum of EMF soup you're bathing in, you'd probably, run scared, right? Because you just see just how much is actually interacting with your body. And so, yeah, that's definitely a major, major thing. But you're right. We can't address it. The cellular industry is simply too powerful. I don't know how they can be stopped.
No, and I think the same with the biopharmaceutical industrial complex. But, each of those 12 domains, I can choose to never eat highly processed food again and only eat organic. I can choose to change the household cleaning products that I use or the personal care products that I use. There's lots of things I can do about all of those things. And I'll tell you a silly, funny story, but a month or so ago, a friend of mine introduced me to the concept of grounding. And basically explained to me, go and hug a tree because it will ground you and suck out the EMF that has been in your body from sitting at your desk in your Wi-Fi soup. Anyway, I've tried it every day, walking the dog, and it's the same tree in the park. Anyway, a week ago, I forgot to switch the Wi-Fi off when I went to bed. Normally I switch it off, and my phone's not in my bedroom. And the next day when I walked and hugged the tree, I could feel that there was a higher level of discharge, if you like, from my body into the tree.
Wow.
And I thought, wow, it was a nanosecond. But there are things we can do about lots of these things. The one I'd like us to really focus on in this conversation is the mRNA technology. I don't understand whether it's Peter McCullough, Pierre Corey, Paul Marek, David Martin, there's Asim Malhotra, there's hundreds and all the amazing work you do. How many more receipts do the governments of the world need to validate our concerns that this is highly dangerous?
We don't actually need any more data. That's the thing. We have so many studies now, thousands upon thousands of studies each week becoming more and more damning. And so, yeah, we already have the clear evidence. Recently 2 groundbreaking studies just came out outlining the rationale for immediate market withdrawal of these shots. So we now have 3 major studies showing exactly why market withdrawal criteria has been far exceeded. These are peer reviewed, right? So that should already be enough. Those compile all the evidence, but most concerningly now is genomic integration.
I read an X post of yours earlier on today where you were talking a lot about that.
Yes. Neo7 Bioscience, we are working with them. They identified in a vaccinated individual's tumor. They developed this cancer shortly following the injection. They looked in the tumor and they actually found Pfizer genetic material integrated into chromosome 19 within this tumor. So that does indicate this appears to be the first direct molecular evidence of genomic integration, and more of this testing is currently underway in many other vaccine injured individuals. So I think we'll have a much better answer, within a few months. We plan on trying to publish this data. So this is the next phase of investigations, right? We've uncovered the myocarditis. We've uncovered even the cancers now. A recent study came out defining turbo cancers. We defined the strokes. We defined the immune dysregulation. So it's all been defined now. Now we have to see, well, did this install into people permanently? And it appears, yes, it has in some individuals.
One of the questions I wanted to ask you about mRNA, I mean, yes, there's heaps of evidence about strokes, myocarditis, cancer, the permanent diminution and destruction of our immune system. But one of the areas that I've started to read about recently is the permanent diminution of people's cognitive abilities, critical thinking skills. And it's almost like people have become less capable of being conscious. Have you looked into this at all?
Yes. We've reported on this frequently. So, what appears to be the case is these mRNA injections act or function as chemical lobotomies, right? So, we now have multiple studies. First of all, we know the vaccine mRNA and spike do reach the brain. They last there for at least 17 months. They found that in a recent autopsy study by Ota and colleagues out of Japan. They looked in hemorrhagic stroke patients, and this mRNA was just riddled within the cerebral arteries years after injection. So we know it gets there, right? So since it gets there, that explains why we see in all these Korean population-based studies have identified major increases in Alzheimer's and mild cognitive impairment. They've identified increases in depression, sleep disorders, anxiety disorders. A study by Thorp and colleagues looked at the VAERS system, identified safety signals for 86 neuropsychiatric adverse events, including homicidal ideations, including psychosis, including schizophrenia. So these do definitely affect psychological function. And this is very bad, right? Particularly since so many people took them. This definitely needs much more investigation. You know, it clearly damages the brain, unfortunately.
There was you've just triggered another question I want to ask you. And I'm not going to be very scientific about this, but I've read a lot about different batches. And there was like hot batches, warm batches, mild batches, saline batches almost, and because lots of people who know that this is a subject I've been studying for 5.5 years. And by the way, I have no medical background whatsoever. But I probably know more about COVID jabs than any GP in this country now. And I always come at it from a sort of critical scientific point of view, which is show me the evidence, show me the research, show me the studies and all the rest of it. But there does, you can still meet people say, oh, David, COVID, it's so yesterday's news and it's so boring, move on. And by the way, I took 2 jabs and I'm absolutely fine. And then you meet someone else an hour later and they say, oh, my sister's had myocarditis, my cousins had this or whatever. And so some people, like, it's nothing to worry about, it's a nothing burger, move on. And other people tell you their horror stories. And so I'm intrigued to know what research has been done on, where there are hot batches and there are saline batches, and whether or not that was by design, do you think, or poor manufacturing quality?
Yeah, there's some people that think it was by design, and there's some that think it was from manufacturing defects. It could be a combination of both. I don't know the exact answer to the intention of that, but it is clear there was massive batch variability, absolutely massive. We do have literally hot lots, right? We have hot lots. 3 peer-reviewed studies now confirm there's about 20% of batches were very deadly, very dangerous, probably had high levels of DNA contamination, probably had heavy metal contamination, probably had high levels of mRNA, many different things. So you have the hot lots that were about 20%, and then you have the other batches called duds, right? They basically caused no adverse events, no deaths, and appeared to be safe to receive. And so that made up, the percentage varies for those so-called dud lots. But it's clear that, most people did not receive the same injection. They were all quite different. And you can actually look up your batch
Mhm.
at howbadismybatch.com to see how many serious adverse events it was linked with. So many people do appear who received mRNA shots do appear, they may very well be in the clear from delayed adverse events, right? So the people that we are most concerned about are those who receive the high risk batches.
I'm going to be respectful of your time and perhaps ask you one last question. As an absolute amateur who's now a pretty well-informed amateur, I've been reading all about this and studying it and watching the High Wire and following people like you for 5.5 years now. And one of my big concerns, which hopefully you're going to either allay or confirm, is that I worry that we've only seen the tip of the iceberg of the carnage that's going to happen to humanity over the next 10 years as a result of this. And if we take all of the evidence and all of the research and all of the findings, whether it's to do with reproduction or cancer or immune damage or whatever, heart damage, psychological damage, emotional damage, there's lots and lots of. I worry that the reports and the figures of the people who've been injured or died or disabled as a result, we've only seen the tip of the spear. And if we come back in 10 years' time and had this conversation, we're going to be saying, well, even though they said it had nothing to do with the jab, look at the decline in morbidity and mortality over the previous 10 years and whether there's causation or just correlation, who knows? But what are your thoughts on my worries?
Yeah, your worries are definitely founded. Definitely founded. We do not know the full spectrum of carnage that has occurred yet, right? It's been about, over 3 years now at this point since the mass mRNA injection campaigns. And we've already seen catastrophic death, injury, and disability. And now, 4 years down the line, we're uncovering new risks. We're uncovering transgenerational risks, right? So that's what kind of confirms your fears. Now we're seeing infants dying at 77% excess now since the mRNA campaign. So it appears this Pfizer Moderna genetic material may be transferring to the offspring.
So can I just pause you? I want to make sure I've understood that last point you made. If I've heard you correctly, what you're saying is that babies of injected parents, presumably the mother, have a 70% higher infant mortality than 10 years ago.
Yes. So actually, for the past 30 years, infant mortality has been on a steady decline until 2021. There was a sharp inflection point. Now it hasn't stopped increasing since the mRNA campaigns. And so even in 2025, yes, babies born after, because we have to remember most childbearing age women did receive mRNA shots, so we do assume most of them received it, and it appears to explain why we're seeing 77% excess mortality of infants, and because these infants are also dying of the same causes seen in excess deaths of adults, of mRNA injected adults, right? So it appears to be similar mechanisms, but yeah, we suspect if this does indeed integrate into the genomes of some women, that could definitely transfer to the offspring in their genetic code as well. And they'll be producing toxic non-human spike proteins and suffering serious adverse events. So yeah, this is very bad, very, very bad. And this is just kind of new, kind of breaking. These signals were identified. And so this is the next phase of we got to start looking into that intensively. Some states here in America have declared a state of emergency recently over excess infant mortality, right? So it's very bad. And we don't know what this is going to look like 10, 20 years down the line. You're right. The carnage we will face in the future from this is quite immense.
Well, on that happy note, no, it's absolutely no laughing matter, and the Truth Contract is doing its little bit. The work that you're doing, Nick, is truly amazing. I probably literally read 2 or 3 tweets from you every single day of the week. They're all brilliant. I like and share all of them, and commented on one which kindly got you to talk to me today. And I think on behalf of everybody out there, I'd like to thank you personally for your commitment to telling the truth, revealing the truth, outing the truth about something which the average human being doesn't really know about, doesn't really understand about. But when they do understand it, know about it, they're horrified. And we want to get as many people as possible to be insisting to our governments around the world that this insanity is stopped as soon as possible. So on behalf of our community, Nick, thank you for the great work you do. Thank you for giving up some time with me today. And let's book in that podcast in 10 years' time when we can check on what's happened. But I'd love to stay in touch with you and maybe have you back on the show sometime. So thank you very much indeed.
Thanks for having me.